Oh, John's not here yet. Okay. Let's continue. The men and women gathered around this table represent the leadership of some of the most significant conservative organizations in the country. Organizations that I am well familiar with, having been involved in the conservative movement throughout my life. And I know the President is very grateful for your engagement, your willingness to continue a discussion on how we move beyond the failed policies of Obamacare and move our country back to a healthcare system built on consumer choice, respect for the doctor-patient relationship, free market principles, and state flexibility and reform for our most vulnerable. But I think the legislation that was introduced this week in the Congress has moved forward through key committees, represents a framework and a portion of the strategy of this administration and leaders in Congress to accomplish that objective. It's what the President likes to call phase one, and that combined with the work at Health and Human Services that's underway right now to take regulatory action that will continue to dismantle the enormous weight of Obamacare on our families and on our economy, as well as begin the process of beginning a national marketplace for health insurance is key. And I was a member of Congress back when this legislation was written behind closed doors and brought to the floor of the Congress with very little input from voices in our party. And frankly, I remember the promises: if you like your doctor, you can keep him. That wasn't true. If you like your insurance, you can keep it. That wasn't true. And the central promise was that the cost of health insurance would go down. And Obamacare has broken that promise. Millions of Americans who've seen the cost of their health insurance literally skyrocket over 100% in some jurisdictions around the country, and last year alone a 25% increase in premiums. President Trump and I, along with leaders in Congress, are absolutely committed to keep our promise to the American people to repeal and replace Obamacare with reforms that will lower the cost of health insurance by harnessing the power of the free market and state-based innovation. But we look forward to your suggestions and recommendations today, and I'm very humbled and very grateful that you would take time to be with us here. Grateful that you're here. And we're here to listen and to